Hi, Benny here again, and welcome back. I know this video is supposed to teach you everything you need to know about the Affordable Care Act and its impact on your small business, but first, you have to hear about a new study that identifies a hidden benefit we will see once the Affordable Care Act is fully implemented. Hey, you don't have to believe me, that funny stick figure guy. This study was published in U.S. News & World Report and was conducted by the Center for Economic Policy and Research think tank in Washington, D.C. Therefore, you know it must be true, accurate, and of course, non-political. Well, they recommend the following advice to all Americans who want to reduce the effects of global warming. Stop working so hard. Just look at the progress we have made over that last few years. We have added millions to the ranks of the unemployed, and even more who are underemployed, working only part-time. Now, add to that, the millions more who will have their hours cut because of the new, proposed health reform rules. These rules define full-time employment status to anyone who works 30 hours per week or more. Who knew that new health reforms would not only impact the cost of your health insurance plan, but now, it is predicted to reduce global warming too. I guess the Great Recession has a silver lining. We should see a significant cooling of the globe. The study suggests, if we trade off up to 1/4 of all income in exchange for increased leisure time and vacation, all nations could, with just a 10-hour reduction per week starting in 2013, possibly prevent up to a whole 1.3 degrees Celsius temperature increase. Of course, as reported, this is only a best-case scenario and assumes we get the same production output as technology improves. I wish you good luck with that. With that story in mind, given all the information and misinformation coming out of Washington these days, we hope you appreciate that we plan to stay focused on just the critical information you and every other small business owner needs to know to make the right decision concerning their company's health insurance plan. This is a lot of information, so we will try to keep these videos short. Although, all the information in this video is available on the yourwellnessandhealth.com website, I would suggest you take out your pad and pencil now. Okay, let's get started. Number 1, the Affordable Care Act, as passed in March 2010, and will change everyone's health insurance plan. Most importantly, starting in January 2014. This law requires all Americans to be covered by a qualified health insurance policy or be fined. Some call this an individual mandate. Officially, it is called an individual shared responsibility penalty. Number 2, all businesses who employ a count of 50 or more full-time equivalent employees must provide health insurance coverage to their full-time employees or be fined. This employer mandate, or employer's shared responsibility penalty, has a set of complicated rules. Please refer to the Post-Decision 2013, Pay or Play, for more on the employer's shared responsibility penalty. How you determine the employee headcount is therefore very important. The average headcount as calculated in 2013 will be used in the 2014 plan year. You can use either the average over 12 months, or the average over a set period of 5 consecutive months during 2013. This means you need to start working on this process now. YWNH has a free worksheet template available to download to help, found on the Do-It-Yourself Free Resources menu. The calculation goes like this. First, you total all the hours worked by all your employees each month, then divide that number by 120. The 120 represents the total of 4 30-hour work weeks which is used as the definition of full-time. Remember how I said earlier that 30 hours per week, not 40 hours, is the new standard for defining full-time status. This means hours worked by your employees over 30 may add up to more employees in the count, and that may put your company over the 49 headcount limit and trigger the employer mandate. See the post. Is your small business ready to pay or play? For more information. Assuming you have a headcount close but over the limit, the simplest tactic to control your health insurance plan cost is to reduce your workforce hours so you can stay under the Affordable Care Act limit. You will need to add a new process to your payroll review procedures each month from January 2013 thereafter. If you were way over in the first few months, you will need to cut back even more from now on for the rest of the year to hit the annual average headcount below 50, or you can use the 5 consecutive month period where you hit this average headcount. So, don't delay. And remember, just because you are below 50 FTE, that does not mean that healthcare reforms will not impact your company. Most experts predict it will be increasing health insurance cost, not reducing costs. Assuming you have determined your headcount using the process described here, and it was less than 50 FTE, you have a much easier set of decisions to make than your larger competitors. We recommend you learn more about implementing the alternative healthcare strategies that are available to maintain the best workforce possible under this new healthcare law is not as simple as cancel your group health plan coverage and let your employees purchase coverage on the new public health insurance exchange. Thank you for listening. I hope you got value from this presentation. Small business owners should learn more about the following: qualified plans under the Affordable Health Care Act, health insurance exchanges, the small business health insurance tax credit, and how to implement a defined contribution health plan, using a simple self-insured health plan, etc.